All of our sporting injuries, hand and wrist. Examination of the hand, all digits point towards the scaphoid tubercle, or point towards here. Again, demonstrating it. They point towards the scaphoid tubercle, not down the arm. The anatomy of the carpal tunnel. Again, demonstrating the anatomy of the carpal tunnel, noting the median nerve and the arterial arches. Dislocation of the MCP joint of the thumb. All the ligaments will be ruptured across here. Easy to reduce, but you need to assess the ligaments carefully. They may in fact need to be repaired. Another dislocated thumb. Assess the ligaments carefully following close reduction. Positive Finkelstein's test, the thumb into the palm, and ulnar deviate the hand. Tender over the first extensor compartment. Tender over the first extensor compartment. Hand examination, see if you can form a fist. Put the fingers out straight. Rotate the hand down. Palmar flex. Say your prayers. Scaphoid impaction test for pain of the scaphoid. Tenderness of the scaphoid. Push the thumb down along the border of the arm, towards the arm. Tender of the scaphoid, there's some pathology there. Fracture of the proximal phalanx involving the MC, going towards the MC joint. Close reduction, possible ORIF. Fracture of the hook of the hamate, easily overlooked point tenderness, may need to be excised if it doesn't heal. Fracture of proximal phalanx, may need ORIF. Transverse fracture of proximal phalanx unstable, needs surgery. Fracture of proximal phalanx stable, splint. Close reduction, fracture child, seldom requires surgery. Internal fixation. Ganglion in the region of the hand. Excise may recur. Another picture of it. Close the mouth of the ganglion after you excise it. Midcarpal instability of the wrist between the scaphoid and the lunate. Demonstration of ligamentous laxity. The ring sign, meaning the FPL and the index finger FDP are working, so the anterior interosseous nerve is okay. Handlebar palsy, where the ulnar nerve is compressed at Guyon's canal. Guyon's canal here. Compress the ulnar nerve. Radial nerve palsy, wrist drop. Inability to straighten the elbow. Again, wrist drop, radial nerve palsy. Ulnar nerve compression, Guyon's canal. Ulnar nerve dysesthesia. OA of the base of the thumb. Old rupture of UCL MCP, OA of the first MCP joint, old ligament rupture. Slack wrist, scaphoid, lunate, advanced collapse following an old scaphoid injury. Again, slack wrist, OA between the lunate and the radius, between the scaphoid and the radius, may end up with a limited or total fusion. Subluxing distal radial ulnar joint, hard to determine. Usually have to send to a hand surgeon. Tendinopathies about the wrist. Most important ones are de Quervain's intersection syndrome. Mallet finger, demonstrated here. Often do well in a splint, sometimes surgery. Bony mallet, if it's a big fragment, surgery. Little fragment, not so good with surgery. Ligament, usually without surgery. Tendons ruptured, long finger, usually involving FDS, FPR, FDP, FDS, FDP, requires surgical repair. Again, test for FDS function. Hold the other fingers out and see what sort of flexion you can get with a single digit. TFCC inflammation, the wrist can be disrupted, seen at arthroscopy, may need debridement or repair. Complete rupture UCL MCP demonstrated here. Older patient may need repair or fusion. demonstrating ski handle injuries, demonstrating the very useful S-thumb splint for skier's thumb injury. The S-thumb splint launched in the US. Stress test showing UCL MCP ruptured, bruising, swelling in the area, difficult to stress test, you need to put some local in. Demonstrated ski stock handle causing the injury, a surgical view of the ruptured ligament being repaired. Buddy strapping of digits for fractures of the digits, very useful. A dynamic splint component, this aluminium with a little foam attached is a useful splint. Position and function of hand injuries, mallet finger splint, anatomy, all digits point towards scaphoid tubercle. Thanks for your interest, and look out for the other talks in the All About Sporting Injury series.